My name is Deborah McLeod. I'm a clinician scientist in psychosocial oncology. One of the projects that I've been involved with since about 2006 is called the IPOD project, or the Interprofessional Psychosocial Oncology Distance Education Project. This project was designed to really increase educational opportunities for health professionals, whether they were practicing or graduate students in universities, so that more and more oncology professionals would be prepared to meet the psychosocial needs of patients. One of the reasons why this was a very high priority for us, for CAPO and for other organizations, is because we were realizing from the data that many patients and family members were identifying that these needs around the emotional aspects of living with cancer, the impact on their lives, how they function day to day, were not being well addressed by health professionals, and part of the issue was the gap in education. And so this project now has been running for about 10 years. We offer a range of courses, and we continue to develop and offer and evaluate how we're doing with education in this area. One of the recent projects that we just finished was called, it was a Partnership in Health Service Intervention, PHYSI project. It was designed to help health professionals at the front line to integrate recommendations to address psychosocial aspects of fatigue, pain, anxiety, and depression. And our results were quite interesting. Certainly there are very many barriers in healthcare systems these days that get in the way of health professionals responding to those kinds of symptoms and others similar to them. One of the biggest ones was time, but there are many others. And one of the things that we found is with the right kind of education, that healthcare professionals, and particularly nurses, became much more confident about how to really effectively help patients in very time-limited ways. So we were quite encouraged with what we were able to accomplish through that educational process and that research project. So the current issues and challenges that we're facing, the barriers, in fact, to ongoing progress in this area, what the next steps are needed. One of the things that's under discussion right now is the whole area of credentialing in psychosocial oncology. We've not had any kind of credentialing. Certainly nurses are familiar with getting credentialed as oncology specialist nurses. We believe there's room in Canada for some certification or credentialing in the area of psychosocial oncology. We believe that putting that kind of process in place will encourage and actually respect, reward, if you will, the education that healthcare professionals, nurses, social workers, and others are doing in psychosocial oncology. So having some way to better recognize the effort and the education that people are gaining, we think is a way of encouraging people to get more education, to commit to it, to commit the time and money to it. In addition to that being an opportunity, we also see a big need for healthcare agencies across the country to really step up in contributing to the agenda of psychosocial education nationally. It makes little sense for us to do it by province. There is a need for a national initiative which has been adopted largely by Souza, but we need governments and agencies to contribute to the funding of entities like that. And I believe, having been involved in education at university, continuing education and healthcare agencies, through the IPOD project nationally, that the most cost-effective way to go about this is with a national institute. I believe that all healthcare professionals have a role to play in psychosocial oncology, and I would like to see a much broader representation among psychosocial oncology specialists of different disciplines. Many disciplines accept that there's some aspect of psychosocial oncology that they're responsible for, that is within their scope of practice, but there's some disciplines that have been underrepresented in psychosocial oncology as a specialist practice. One of the key ones here, I think, is nursing. We accept social workers and psychologists, spiritual care providers, psychiatrists are all potentially specialists in psychosocial oncology. We've not seen nurses step into that role as much. Part of the difficulty is that we're focused on oncology nurses whose commitment is to oncology. And in fact, a psychosocial oncology specialist role requires a commitment not only to oncology, but perhaps even more importantly to mental health. And so it requires a blending of those roles. If someone wanted to do a specialty practice in this area, wanted to pursue a career in psychosocial oncology, typically we're looking at education at a master's level. And in nursing, for example, one would need to work with a mentor to structure and create both theoretical learning as well as supervision in practice. I believe there's lots of room still for health professionals to develop and grow into that area. And I hope to see a lot more nurses in the future take that on as a practice.